one of those necessary evils, guys. Nobody loves wearing them. They're uncomfortable, they're tight, they're hot, they're definitely not pretty, but they are so important in how you recover in your final results after liposuction. On today's episode, we are going to dive deep into compression. This is Lipstick and Lipo. I'm Dr. Smita Ramanathan, board certified plastic surgeon, and I've got my co-host with me, Dr. Ashley Amalfi, and we are diving deep today, guys.
Hi, guys. Compression garments. This is such a hot topic for lipstick and lipo. And I don't know if it's because you guys love or hate them. Probably a little of both, right? Compression garments are just like a love-hate relationship because they're, like Smita said, a necessary evil.
Yeah, they really are. And the thing is, there's so much variety in it. So I think a lot of people get caught up in which is the right one. And you talk to every person and there's a different recommendation. And it can be really confusing. But the most important thing is you just want to wear one, right? I mean,
Oh,
it,
yeah.
the details don't necessarily matter as long as you're wearing it and it has the appropriate compression. So,
Yeah. I
yeah,
mean, let's talk about the why, and then
yeah,
we'll talk about the what,
yeah,
right?
right.
So,
So,
I mean, why wear compression? Compression really, the goal is to reduce postoperative swelling and to minimize any contour irregularities. That means any weird, lumpy, bumpy, swollen areas. And so, compression does just that. It compresses and tightens things and honestly almost like smooths them out. So, whether you've had liposuction or a tummy tuck or sometimes even a breast lift and reduction, compressing those areas prevents too much unnecessary swelling so that you get this gorgeous contour right away. And sometimes it feels really tight and awful, but it's one of those things that you get used to. And then sometimes you learn to love it.
yeah.
Yeah.
And the thing is too, right? I always say whenever we're doing liposuction, right, we're removing the fat or even after a tummy tuck, we're creating space and our body just wants to fill it up, right? So whether it's fluid, swelling essentially is just fluid. And so we need to get rid of that, right? The quicker that goes away, the quicker the skin can start to retract and we want it to be smooth. Shrink, right. And, swelling lasts a lot longer than what we think, right? So it's 6 months to 1 year. Usually that 1 year mark, it's most of it is gone. And maybe we can see it as surgeons and you guys probably won't notice, but it's just so important. But compression just really keeps everything nice and tight so that fluid can just really be reabsorbed. The skin can start to make its way to its final result.
The beginning is probably the most important, guys. Does anyone really wear compression for a year? Some people do, but I would say most people don't. But those first 3 months, that's probably the most important, most critical period where everything's kind of shrinking up and you're going to be the most swollen and it's going to give you the best results. I mean, if you guys think about it, if something's all puffy and swollen and filled with fluid, then it's not going to heal as good because it's going to put a lot of tension on the incisions and on your stitches and your scars. And if things just shrink down quickly, that's going to help everything heal in a really seamless way. So I would say it's most critical immediately after surgery in the first 3 months, but everyone's different. I have some really tiny little tummy tucks that are pretty swollen for 6 months. And honestly, some active people who still have swelling that full year. Now, it's not so much swelling that you don't want to, wear cute, tight clothes, but there's still swelling there. And if there's still swelling, then compression still has a usefulness for you, even though it might not be the most exciting thing for you to put on.
Yeah, exactly. Well, and it's also really critical, I think, in that time period where liposuction tends to backtrack. You know what I'm talking about, Ashley? Like around that 2 week to 6 week mark,
Yes.
things almost start to revert, right? It starts getting hard and lumpy, and that's normal.
Yes.
In the smallest areas, like under the neck, it will
Yeah.
start hard. And
Armpits. Yeah.
yeah, the armpits, and it just, and it's because your body just starts to want to scar things down, right?
Yes.
And it doesn't have that intervening fat to keep things nice and smooth. So really using that compression is key during that time period. But we're talking 24/7, right? I mean, take it off
Yeah.
the shower if you need a breather
Yeah.
by all means, but you're going to be wearing it
For months. Yeah.
hours out of the day. Exactly.
Yeah.
It'll be
And then
worth it, right, at the end.
when people come out of it, then they start doing like the day versus night. Like after they've had it on for a few months, then I'll tell people, okay, if you get really swollen and you're really active during the day, wear it during the day. And then you could take a breather at night. And some people like it sort of vice versa. They like to not have it on during the day because it's kind of chunky under their clothes, but then they do get a little bit swollen. So they put it on back at night for a reset. But that's not until you're, 2, 3, 4 months post op that you want to start cutting back. But that's a nice way to kind of graduated reduce how much you're wearing it. Don't put it in a bonfire, even though I know you want to. How to pick which compression you wear? I mean, it's kind of like underwear. Like if you tell someone, "Oh, I love this brand of underwear," it doesn't mean they're gonna like it because our bodies are so different. And I think that that's why there's so many types and styles and brands, right? Like no
Yeah.
two people love the same one.
Right. And, and I think, there's certain, it's like the brand name, right? Like Faha. People love Faha. But I personally don't love them. They're great in some people. But, I think the most important thing is when you get a compression garment, we often will put you in one during surgery, right?
Yep.
But you're going to need multiple. You're going to, get less swollen and need to downsize on the
You're gonna
garment.
shrink, guys. Literally, you will shrink.
Yeah. So, at that point, I really just tell people bring to the office like a bunch of different types that you've bought. You can really get them anywhere on
Yes.
Amazon, you know, order a bunch of different types. For me, the most important thing is I don't want zippers or seams in the
Mhm.
where we did the liposuction, right? Because
Yeah.
if you're wearing that 24/7 and things are still healing and they're swelling, I don't want those permanent
The
grooves.
dent. Yep.
Right? And so that's what I'm checking to make sure there's no grooves. And I
Right.
always tell people too, when you try on a new garment, put it on for an hour or two, take it off and
Yeah.
see it leaving marks on you. And if it,
Yeah.
then you're going to have to shift something or try something else.
Yeah. And maybe alternate too. Like if you have a couple that you like, wear different ones every other day so that they're kind of compressing in different ways and not recreating the same sort of pressure points
Mhm.
so that everything is nice and smooth. And when in doubt, you guys just ask us, and every case is going to be different. We can't say that, like, okay, at 8 weeks, you could do this, at 12 weeks, you could do this, because everyone's level of swelling is different. And so you don't want to set too many timelines for yourself because then you'll get disappointed. Because if we tell you you need it longer, it's just because we want you to have a beautiful result and the best contour you can. And so, text everyone, leave comments if you guys have a brand that you love, you've found something that works. I want this to be like supportive for everyone else out there who's trying to figure out what compression to wear. So please comment below with what you love and what worked for you. Tag us, Lipstick and Lipo, and we are so excited for you guys to be following along. Check us out on YouTube, Apple, Spotify, and we can't wait for the next episode of Lipstick and Lipo.
We'll see you guys later.
See you guys.